Many thanks for the award. It's great to be recognised for this research project. I'm Alex Voskoboinik from the Alfred and the Baker Heart and Diabetes Institute. The research I'm presenting is titled Alcohol Abstinence in Drinkers with Atrial Fibrillation, published in the New England Journal of Medicine. There are multiple mechanisms linking alcohol to atrial fibrillation, both with regards to alcohol being a trigger for atrial fibrillation in the setting of an acute binge, and also alcohol's direct and indirect impacts on the atrial substrate, particularly left atrial electrical and structural remodeling. So I guess that begs the question, does reduction in alcohol intake or abstinence help improve outcomes in the AF population? And to date, there have been no randomised trials looking at this topic. Our inclusion criteria for this study, 140 patients, was paroxysmal AF or persistent AF with a rhythm control strategy and sinus rhythm at baseline, and what we define as moderate alcohol consumption, 10 standard drinks per week or more. This was run across 6 hospitals in metropolitan Melbourne and was a randomised controlled trial with one-to-one randomisation to undertake either abstinence or continue usual consumption, with comprehensive rhythm monitoring and a follow-up period of 6 months, which was actually shortened from 12 months during the study. All patients in the abstinence arm were counselled to abstain completely, and those in the control arm were allowed to continue their usual alcohol consumption. And there was frequent contact with participants in the abstinence arm, particularly from study investigators, and there was urine testing for alcohol metabolites to monitor for compliance. There were 2 primary endpoints: freedom from AF recurrence and AF burden. 697 patients met the inclusion criteria, although the majority were excluded due to lack of willingness to consider abstinence. Another 36 fell out in the run-in phase, and then 70 patients were randomised in each arm, and the majority completed follow-up. In the abstinence arm, there was a reduction in average alcohol intake from 17 to 2 standard drinks per week, and 61% had complete abstinence based on both alcohol diaries and a urine ETG monitoring. Patients in the control arm had a small reduction in alcohol intake over the course of the study. The study was positive in that alcohol abstinence was associated with the reduction in AF recurrence rate, which was statistically significant. And similarly, there was a small but significant reduction in overall AF burden in the abstinence group compared to the control group. Patients in the abstinence group also reported lower atrial fibrillation related symptoms. And there was also a modest reduction in systolic blood pressure and weight in the abstinence group. So in conclusion, in AF patients who consumed moderate amounts of alcohol, alcohol abstinence was independently associated with reduced AF burden, reduced AF recurrence rates, improvement in symptom severity, weight loss, and improved blood pressure control. Thank you for your attention, and thank you again for this award.